Hello, dear aspirants. Welcome you all to Master Nursing Classes family. So, good evening, beta, good evening. So, welcoming you all once again to this beautiful learning session. So, in this today's particular video, so we will discuss those very important questions that may comes in your RRB exams and Norcet exams. So, as we are studying the very important classes for the OBG, so still 5 to 6 classes will be there on the OBG. So on that classes, I will discuss those very important topics that may directly strike in your exams. Okay. So in the today's learning session also, we will learn some new questions, some criteria, some diagnostic evaluations. Okay. So very important questions that may strikes with same options in your exams. Okay. So students, not only we are discussing the questions here. So we are discussing the very beautiful concept with a very easy and understanding manner. Okay. So if anyone is new to the our MNC family, so do subscribe to the channel. Okay, so we are having one beautiful Telegram group. Already 1,000+ members are enrolling there. So if you want to become a part of our Telegram group, so the link is there in the description box. You can join there. Okay, so in that Telegram group, we are discussing the very important questions, including the nursing, non-nursing questions also. Yes, so some updated contents also we are releasing over there. If anyone is interested to become a part of our Telegram group, the link is there in the description box. Okay, and the link will come in the live session also. You can join from there also. Okay, no problems. Yes, very nice of you all. Okay. Yes, good evening, beta. Good evening. Welcome once again to Master Nursing Classes family. So in this today's session, so there is no any faltu baat, only the words which will are coming from my side is to get selections to you all. Okay, is to get a filter your ranks and to become a nursing superintendent or the nursing officer in AIMS and RRB exams. Okay, so there is no any time use in the session. Okay, yes, before going to the main sessions, here is some beautiful points for you all as a motivation. Yes, students, if you feel down, or if you are feeling to quit the a process of the learning, so remember why you have started. You have started to come out of the struggles. You have started to get out of this junk zone. Okay, so you are started means you don't have to end it. You have to finish it a good results. So that is the beautiful characteristics of the champions will start and they will finish properly. Okay, how you will start, that is not going to matter. How you will finish the chapter, that is going to matter very much, students. So yes, without wasting the time, yes, good evening, beta. So we'll start the today's class. Be a good finisher, be a perfect finisher, be a game changer, be a game winner. Okay, yes, so we'll start today's class. Okay, here's the beautiful motivational quote completed, and here's the beautiful question in front of you all. Okay, so do read the question properly, perfectly, and try to give the best answer for this particular question. Okay, yes, the question is very simple. When is the first antenatal visit typically scheduled? Okay, so the first antenatal visit when we have to schedule. Okay, so very simple, and a very simple question and very important question. Yes, option A is telling that the 4 to 6 week of the pregnancy. Option B is telling that the 8 to 12 weeks of the pregnancy, then 24 to 26 week of the pregnancy, then comes to the 32 weeks of the pregnancy, and option E is telling that the 36 to 38 weeks of the pregnancy. But when is the first antenatal visit we have to typically schedule? Okay, who all are giving the option A is the correct answer. That is the wrong answer, bacho. Yes, now the next answer is yes. Very nice of you all. Who all are giving the B is the correct answer. That is the correct answer. First antenatal visit we have to schedule on the 8 to 12 weeks, means at the end of the first trimester. So this is the first antenatal visit. Okay, antenatal visit is not means that the female have to go to the healthcare settings. It also including where the ANMs, ASHA workers, or the female health worker who is giving the home visit also. That is also considered in the antenatal visits. Okay, so it is very mandatory to give the antenatal visits. Okay, India recommends minimum 4 antenatal visits. According to the government of India, how many antenatal visits? Yes, how many antenatal visits according to government of India? That is the 4 antenatal visits are the minimum and very important. Okay, this is the mandatory. Okay, first visit we have scheduled on 8 to 12 weeks, and 24 to 26 weeks second visit we have to schedule. Okay, this is the second visit we have to schedule. Then at the 32 weeks, this is the third visit we have to schedule. And yes, very importantly, 36 to 38 week, this is the fourth visit. Very importantly, according to the government of India, 4 schedules are mandatory. So these are the schedule times. Very importantly, It's mandatory to all pregnant women. Okay, so to get the 4 antenatal visits. Okay, my next question is, how many antenatal visit the WHO recommends? Okay, current, not old one. You have to say the current answer. How many antenatal visit the WHO, the World Health Organization, recommends? Yes, previously it was minimum 3. Previously it was minimum 3. Now, yes, minimum 8 visits the World Health Organization recommends now. Okay, so minimum antenatal visit recommended by the World Health Organization is 8 minimum antenatal visit. Ideally it is 13 to 15. Okay, 13 to 15. This is not going to happen in India. Okay, yes, that's what the WHO recommends, 8 minimum antenatal visits, and government of India recommends minimum 4 antenatal visits. Previously WHO recommended minimum was 3, so now don't give answer as a 3. Okay, now minimum is 8. Okay, hope the concept is clear. Okay, and here's the next beautiful question in front of you all. Okay, so do read the question properly, perfectly, then try to give the correct answer. Okay, yes, the question is very simple. Which of the following is considered a normal blood sugar level? Okay, 2 hours after the glucose challenge test. Okay, so 2 hours after the glucose challenge test. Bacho, so this is 2 hours after the glucose challenge test. This one we can say in short term GCT, or that is the oral glucose tolerance test. Okay, so this type also they can write in the exams, both are similar. Okay, there is the glucose challenge test, or else we can say oral glucose tolerance test, both are same. Okay, OGTT and GCT both are same batch. Okay, yes, what is the normal blood sugar level 2 hours after the glucose challenge test? Okay, yes, can anyone wants to answer for this one perfectly? Yes, yes. So that is the very correct answer. All are giving the option C. Option C is the correct answer. Okay, it is less than 140 mg per deciliter should be the normal value of the glucose challenge test. Okay, so yes, students, there are many questions which will comes in our exams. Okay, how much gram of the glucose we have to give to a pregnant woman? Yes, how much gram of the glucose we have to give to a pregnant woman? Do fatafat comment in the comment box, bacho. Yes, very nice. That is the 75 grams of the glucose in 300 ml of the water. Okay, in 300 ml of the water. Okay, we will mix and we will give to the pregnant woman. Okay, yes, after the 2 hours, we have to assess the blood glucose level of that pregnant woman. Okay, we have to assess the blood glucose level of the that pregnant woman. Okay, so the three results we will get here. Three results we will get, whether the value will come less than 140 gram per deciliter, or else it will come 140 to 200, okay, gram per deciliter, or else it will come more than 200 gram per deciliter. These all three values indicates the three important features. Okay, so that is, if it is coming less than 140 gram per deciliter, so that indicating the normal blood glucose level of the pregnant woman in pregnancy. Very very important. If it is coming 140 to 200 gram per deciliter, that is indicating the, yes, gestational diabetes. What it indicating? Gestational diabetes. Okay, what is gestational diabetes? Gestational means pregnancy induced diabetes. Okay, so if it is coming more than 200, it indicating that is the overt diabetes. Okay, overt diabetes mellitus. Very very important. Now tell me, what is the difference between the gestational diabetes mellitus and overt diabetes mellitus? Yes, there are two situations in the pregnancy, so that indicates the gestational diabetes mellitus, or yes, the overt diabetes mellitus. Simple. She is normal woman. Okay, she is normal woman. She got pregnant. Okay, she is normal woman. Okay, without any diabetes. Now she got pregnancy. Okay, now she got pregnant. Because of the pregnancy, there is one hormone in the pregnancy, that is the human placental lactogen. So this hormone is responsible for the, yes, resistance to insulin. Okay, which creates the resistance to insulin. So insulin resistance means insulin won't works. Okay. So what is the normal function of the insulin? Insulin, this is the blood, this is the cell. Okay. Insulin converts the free flowing glucose into the glycogen, and this glycogen will be stored in the cells of the liver. Okay. So this is the function done by the insulin. So the resistance to the insulin means insulin won't work, means this free flowing glucose will not convert into the glycogen and will not store into the liver, means the glucose in the blood remains continuously high. Okay, remains continuously high, that is the high glucose in the blood we call as the diabetes. Okay, so she is normal woman, she got pregnant now because of the human placental lactogen, because of the excess insulin resistance her blood glucose level is increased. Okay, her blood glucose level is increased more than 140 till 200 gram per deciliter. Okay, so these situations we call as in the gestational diabetes mellitus. Okay, this situation we call as in the gestational diabetes mellitus. There is another condition, bachon, there is another condition. Okay, so she is not a normal pregnant woman, she is not a normal pregnant woman, she is not a normal woman, she is a non pregnant. Okay, plus diabetic mellitus. She got pregnancy now. Okay, she got pregnancy now. Okay, so this is what we call as in the overt diabetes mellitus. Overt diabetes mellitus. What happened here? Okay, in the gestational diabetes mellitus, she is normal woman without diabetes. She got pregnant because of the HPL and insulin resistance. Now her glucose level is increased. That is called as the gestational diabetes mellitus. She is already a diabetic woman. She is already a diabetic woman, and now she got pregnant. Now she got pregnant, and her blood glucose level in OGTT, which is coming more than 200 gram per deciliter. So this is what we call as the overt diabetes mellitus. But I hope the concept is clear. The difference between the, yes, non-pregnancy and overt diabetes and gestational diabetes is clear, I think so here. Okay, so very importantly, and the answer for this question is the, yes, the normal is less than 140. 140 to 200 is the gestational diabetes. More than 200 which is coming, that is the, yes, the overt diabetes. Very importantly, how to remember this flow chart and practice this flow chart 2 times, that will be helping for you all. Okay, so yes, first MCQ they will ask, okay, how much glucose we are giving? 75 gram of the glucose. Okay, in how much ml of the water? 300, and in some book it is given 350 also. Okay, so the time duration we have to wait is the 2 hours. Okay, in some book it is given 1 to 2 hours. Okay, in some book it is given that is 1 to 2 hours. Best answer is 2 hours. If option it is not there 2 hours, you can choose the 1 hour also. Okay, if there is no option in the exams related to 2 hours, you can choose the 1 hour also. Okay, yes, so if both 1 hour also there, 2 hour also there, so you can choose the best answer as a 2 hours. Clear? If 2 hours is not there, then only give 1 hour as an answer. Okay, then yes, this readings also we have discussed. Okay, it is very important, bachon. Yes, so here in the question it is they have asked for the normal, so it is less than 140, it is the normal. Clear? Yes, very nice of you all. And here is the next and very important beautiful question in front of you all. So do read the question properly, perfectly, then try to give our best answer in the comment box. Okay, yes, I'm waiting for your answer in the comment box, bacho. Yes, do read the question. Which of the following is a risk factor for asymptomatic bacteriuria? So, what is the asymptomatic? What is the bacteriuria? Asymptomatic means there is no symptoms, but there are bacteria in the urine. Okay, so there are bacteria in the urine. Okay, yes. So, which of the following is gives the pregnant woman or for the highest risk of the asymptomatic bacteria? Whether a diabetic mellitus gives the highest risk, hypertension, asthma, hyperthyroidism. Which of this particular condition as a place as a high risk condition for the asymptomatic bacteria here? Yes. So yes, the risk factor for the asymptomatic bacteria is the, if the female is diabetic and she is got pregnant, so she may get asymptomatic bacteria because in the diabetes there is increased blood glucose level, there is increased glucose. So glucose is a main source of energy and food for the bacteria, so the bacteria will grow rapidly in case of the diabetic conditions. Remember students, they have asked the many questions on the diabetes and infection It is very very important. So in the diabetes there is the highest risk and chance of the infection. Why? Because in the diabetes the blood glucose of the that particular person is high. So because of that, so the glucose, the bacteria loves the glucose, the bacteria wants to eat the glucose, means their bacteria getting the lots of the glucose, food, energy, everything, means they will act rapidly and they will divide rapidly and they will grow rapidly, and there is highest risk of infection in the diabetes. Okay, so because of that we will not recommend a catheterization also in the diabetic patient. Okay, why? Because again catheterization is a source of infection, and there is a risk factor, that is the diabetes. Okay, so there are lots of the questions they will ask on the diabetes. Very very importantly, you have to keep in mind, wherever the diabetes there is the highest risk of the infection. Okay, so now come to the very important points on the asymptomatic bacteria. So you have to know what is the most common cause of the asymptomatic bacteria. Okay, most common cause. Okay, what is the most common cause for the asymptomatic bacteria? Yes, can anyone ever wants to comment in the comment box? What is the most common cause for the asymptomatic bacteriuria? Yes, that is the E. coli. E. coli is the most common cause for the asymptomatic bacteria. So, what is the bacterial load we have to say? That is the asymptomatic bacteria. Yes. What is the initial investigation? And what is the initial investigation? That is the CUE. Is the initial investigation. That is the clinical urine examination. Okay. Clinical urine examination is the initial. Okay, this is the initial investigation. Okay, this is the initial investigation. So when we will send the urine of the female to the lab, in the lab they will check the load of the pus cells. Okay, load of the pus cells, if it is more than 10 to the power of 5 pus cells per 1 ml of the urine, per 1 ml of the urine. So this is what we call as the bacteriuria. What we call this one as in the bacteriuria. But the female may not have the symptoms. So we call this one as in the asymptomatic. Asymptomatic means there is no symptoms. This is the bacteriuria, means there is more than 10 to the power of 5 per cells because of the because of the excessive bacteria in the urine. So this is what we call the bacteriuria. Okay. Okay, very very important. That is the asymptomatic bacteria. Female will not show the symptoms, but there is in the bacterial infections. So then why we need to look it further? Why it is important to study? But very very important. We have to know the asymptomatic bacteria. If we kept untreated, so if we left it untreated, it may leads to the preterm labor, or if we left untreated, it may leads to the pyelonephritis. Okay, it may leads to the pyelonephritis. Okay, so it may leads to the premature preterm labor, or it may leads to the pyelonephritis. It is very very dangerous. A simple some bacterial infections which is making a preterm labor, a simple bacterial infections which is damaging the entire kidney of the that particular female, means it is dangerous. So that's what we have to study the asymptomatic bacteria. Okay, the initial investigation is the clinical urine examination. The investigation of choice is the urine culture and sensitivity. So in the urine and culture and sensitivity, 99% the E. coli will be isolated. So we will start the treatment for the E. coli. We will give the antibiotic. Okay, so most commonly used drug is very very important. You have to understand, that is the tablet nitropurantine. Okay, tablet nitropurantine. Okay, in the hospital settings we call this one as in the tablet niptas also. Okay, what we call this one, the nitropurantine. So we can call this one as in the tablet nitropurantine or tablet niptas. Very very importantly, we have to consider this one in your mind. Okay, the initial investigation is the CVV. The confirmatory test is the culture and sensitivity of the urine. Okay, so the bacterial load in the CVV should be more than 10 to the power of 5 per cells per 1 ml of the urine. Okay, so there should be no any symptoms but the load of the bacteria which leads to the preterm labor and pyelonephritis. That is what it is very very important to study the asymptomatic bacteria, okay, in order to prevent the preterm labor and the pyelonephritis of the female. Okay, hope the concept is clear. And here is the one more beautiful question in front of you all. So do read the question properly, perfectly, then try to give the best answer for this particular questions. Okay, so what is the recommended waiting period to conceive after receiving the rubella vaccine? Okay, so how much time of the period of female should wait after taking the rubella vaccine to get pregnant? Okay, yes, all of you know that rubella vaccine is the live vaccine. Okay, live vaccine, and live vaccines are contraindicated in pregnancy. Live vaccines are contraindicated in pregnancy means if the female she taken the rubella vaccine, she should wait for a particular period of the time, then after that she may get pregnant. Okay, she can get the pregnant. So how much duration she can wait to get pregnant here after receiving the rubella vaccine? Yes bachon, the old concept was the 3 months, so now no need for the 3 months. Okay, that is the 1 month is the enough. Okay, after getting the rubella vaccine she should and must wait for the 1 month. Okay, so after waiting for the 1 month she can get conceived. Why? Because the rubella is live vaccine. Immediately after the taking the rubella she get confused means yes it may leads to the uh, congenital rubella syndrome. In order to prevent that, we have to advise the female to use the barrier methods of the contraceptives 1 month after the conception. Okay, so 1 month after the taking the rubella vaccine, it is very very important. Okay bacho, so we have pregnant should be female should be wait for at least duration of the 1 month. Okay, so to get conceived after having the rubella vaccine. Bachchan clear? Yes, yes, very nice of you all. Okay, it is very very important, and rubella vaccine is very very and very important in the pregnancy. Okay, so what all are the scenario based questions they can ask on the rubella is the like this. Okay, so whenever the female come for the antenatal clinic, okay, so we have to ask her for the yes measles, mumps, rubella vaccination history, or we can ask for the any kind of the rubella infections. Okay, if she got mmr vaccines already, or if she is having the rubella infection previously. Okay, so then we have to check for the antibodies. We have to check for the antibodies. Okay, so antibodies are present. Okay, antibodies are present means no problem. Okay, so no problem, she can get pregnant. If antibodies are absent, means okay, we have to confirm the pregnancy. Okay, we have to confirm the pregnancy. If she is not pregnant, then give the rubella vaccine and ask her to wait for at least 1 month, then she can get pregnant. If she is already pregnant, okay, if she is not pregnant, give the rubella vaccine, then ask her to wait for 1 month. Okay, if she is already pregnant, means nothing we have to do. We have to only advise to avoid the crowded spaces. Okay, we have to only advise to avoid the crowded spaces. Okay, if in case antibodies are absent, so this is what we have to follow. Okay, very very importantly. Okay, yes bachcho, clear? And remember, rubella gives the lifetime immunity. Okay, it will give the lifetime immunity. Very very important. Okay, rubella gives the lifetime immunity, so that's what we have to assess for the history of the mmr vaccine, or yes, we have to assess for the very importantly history of the infections related to rubella. Okay, yes, clear bachcho? Yes, very nice of you all. And here's the next question in front of you all. So do read the question properly, perfectly, then try to give the best to best answer for this particular question. Yes, the most common cardiac defect associated with the congenital rubella syndrome is, so which of the following is the most common cardiac defect which is associated with the congenital rubella syndrome? Okay, so option A is the ventricular septal defect. Option B is the patent ductus arteriosus. Option C is the atrial septal defect. Option D is the tetralogy of the palate. Yes, which of the following is the most common cardiac defect which is associated with the congenital rubella syndrome? First of all, we have discussed what is the rubella. Okay, so in the rubella, we have discussed the rubella vaccination and the time gap to get pregnant after the taking the rubella vaccination. That is the 1 month. Okay, if in case she got the rubella infections or the rubella vaccination, within 1 month she get pregnant means this rubella is the teratogenic, which crosses the placenta and which will go to the fetus and it will damages the fetus. We call this one as in the yes the it will brings the some sign syndrome that is called as the congenital rubella syndrome. Okay, so in this one there are three major organs to get damages. One is ear will get damages, one is heart, one is eye. Okay, one is eye. So what happens in the eye? So are you people able to see this? Okay, these eyes. So this is the congenital cataract. Congenital cataract. What happens in the heart? Are you people able to see here? Yes, this one. Let me highlight with the different color here. Yes, this one. So here it is the descending aorta like this, and here it is the pulmonary artery. So there is connection between the descending aorta and pulmonary artery. This is normal in the intrauterine life. Okay, after birth it should be closed. Okay, it is not closed means it is remains patent means this particular structure we call as the patent ductus arteriosus. Okay, so this is the normal connection between the uh, descending aorta and our pulmonary artery. So this is normal in the intrauterine life. So this normal connection we call as the ductus arteriosus in the intrauterine life. It should be closed after birth of the baby. If it is still not closed, it remains patent only. So that is what we call as the patent ductus arteriosus. Okay. So this is the patent ductus arteriosus. Is the PDA is the specific heart disease we can see in the congenital rubella syndrome. Okay. And I told the ear effect. Okay. Effect on the ear. Okay, so there is sensory neuronal hearing loss. Okay, sensory neuronal hearing loss. बच्चों, so we are having the three types of the hearing loss. One is conductive hearing loss, one is sensory neuronal hearing loss, one is global hearing loss. Okay, in the conductive hearing loss, what happens? Because of this some excessive wax accumulation in the external and the middle ear, so we can't able to conduct the our sound waves into the electrical activity. So that may leads to the conductive hearing loss. It may be due to the otitis media, it may be due to the accumulation of the wax inside the external and middle ear, it may be due to the damage to the tympanic membrane, or it may be due to the damage to the our ear ossicles, that is the incus malleus and stapes. Okay, so if in case the external auditory canal is the full clear, the middle ear is the fully normal, and in the inner ear there is damage to the eighth cranial nerve. The nerve name of the eighth cranial nerve is the vestibulocochlear nerve. So if in case the vestibulocochlear nerve is get damaged means it is very very important to understand the hearing waves will be transmitted to the brain by our vestibulocochlear nerve. So the damage to that nerve which leads to the sensory neuronal hearing loss. Okay, if the eighth cranial nerve get damaged, so which leads to the sensory neuronal hearing loss. Okay, so in the congenital rubella syndrome, classically we are getting the three symptoms that is related to eye, that is the congenital cataract. One is related to the heart, that is the patent ductus arteriosus. One is related to the ear, that is the sensory neuronal hearing loss. So, in the above question, what they have asked, what is the most common and specific cardiac defect which is associated with the congenital rubella syndrome? Already we have discussed, that is the patent ductus arteriosus, and some of you have given the correct answer as option B already. So that is the correct. Okay. Yes, bachon, is that clear? Yes, very nice of you all. Okay. So here is the next question in front of you all. Okay, do read the question properly, perfectly, then try to give the best in the comment box. Okay. Yes, the question is very simple. Which organization recommends the replacement of the TT vaccines with the TD vaccine for pregnant women? Okay, so previously, when the pregnant woman comes to the PHC, CHC, sub center, or any district hospitals, we used to administer the injection tetanus toxoid, that is the TT. Nowadays, if the pregnant woman comes, means we have to administer the TD. Okay, we have to administer the TD vaccine. So, which organization replaced this one? Okay, in place of the TT, we are giving the TD. So this is the recommendation of the which organization? Option A is the CDC, that is the Center for Disease Control, and option B is the WHO, World Health Organization. Option C is the UNICEF, that is the United Nations International Children's Emergency Fund. Then option D is the Food and Drug Administration Authority. Okay, so yes, so very very importantly, yes, who recommended that one? Almost all of you have given the B answer that is the WHO. That is the correct answer. Okay. So WHO recommended, okay, TD in place of the TT. Okay. So don't give only TT. You have to give the TD in for the pregnant woman. Okay. So this is recommended by the World Health Organization. Okay. But you remember, so they can ask the full form or the extension of the CDC. Okay. CDC is the Center for Disease Control and Prevention. Very, very importantly, and for the UNICEF also they can ask the extension of this one, okay, or the full form of the UNICEF they can ask in the exams for the RRB. Okay, so that's what also you have to understand, that is the UNICEF, United Nation International Children's Emergency Fund, and FDA also they can ask, that is the Food and Drug Administration Authority of India. Okay, so very, very and very importantly you have to understand this one and answer for this question. Okay, so that is the WHO recommended. Okay, so now tell me the answer for this particular question what I'm asking now. So when we have to give the first dose of the TD, okay, when we have to give the first dose of the TD1, okay, when we have to give, okay, that is the as soon as possible after pregnancy. Okay, in pregnancy. Okay, this is the first dose. So after this one, how much gap need to maintain for the TD2? For TD2, how much gap need to maintain, bachcho? Yes, do comment in the comment box on what is the gap between the TD1 and TD2 we have to maintain. That is the tetanus and diphtheria dose 1 and tetanus and diphtheria dose 2. Okay. So how much gap we have to maintain here? Yes, that is the 4 week or 1 month. Okay. Very, very importantly, this should be the gap between the TD1 and TD2. Okay. So yes, and in second time, if the female is get second time pregnant, okay, so she in the first trimester, she first pregnancy she got the TD1 TD2 both, okay, vaccines, and within 3 years she got pregnant, means within 3 years she got pregnant. Now can we have to give the complete vaccination or else only booster dose? Do comment in the comment box. In the first time pregnancy she got the TD1 and TD2 both the vaccines, and again she second time got pregnant within 3 years of the first pregnancy. So now which vaccine we have to give? Sorry, yes, the what is the dose of the TD vaccines here now? Yes, can we repeat the full TD1 and TD2, or else only booster dose is required? Yes, only booster dose is required. That is the very much correct answer. That is the booster dose. Okay, only booster dose is recommended. When you will be giving the booster dose? First trimester, second trimester, or the third trimester? When we have to give the booster dose? Yes, in the third trimester. Okay, in the third trimester, the booster dose is recommended if the female got pregnant within 3 years of the first pregnancy. So that is the very, very important, and she should and must take on the TD1 and TD2 in the first pregnancy, and again she got pregnant second times within 3 years of the first pregnancy, then only booster dose is recommended. That is the in the third trimester only one booster TD is recommended. So very, very and very important, you have to remember and understand. Okay, yes, clear bachcho? Clear. Okay, so if she got pregnant after 3 years of the first pregnancy, then repeat the full dose of the vaccination. Okay, then repeat the full dose of the vaccination. Clear? Here T stands as a tetanus and D stands as the diphtheria. Clear, bachcho? Yes, very nice of you all. Okay, so then here is the next question. Okay, so this is the most important questions for you all. Okay, this is the most important for you all. Which of the following vaccine is generally considered safe for pregnant women? So here is the list of the vaccines. Among this list of the vaccines, you have to understand and identify which vaccine is generally considered as a safe for the pregnant woman. Is the measles, mumps, rubella is safe for the pregnant woman? If we give the MMR in the pregnancy, okay, so it is having the rubella which causes the congenital rubella syndrome, means it is not safe in the pregnancy. And we have just studied that if we given the MMR vaccine or the rubella vaccine to pregnant woman, sorry, to a normal woman, so she have to wait for at least 1 month to get conceived in order to prevent the congenital rubella syndrome. Then option A is not our answer. Okay, so then comes to the varicella. That is the chicken pox. Okay, chicken pox is also live vaccine which is completely contraindicated in the pregnancy. Then comes to the HPV. That is the human papilloma virus. Already we have discussed in the last class. Okay, so related to the Gardasil. Okay, Gardasil 9, and very, very importantly we have discussed the one more. That is the vaccines for the HPV. That is, yes, which the vaccine name? Yes, that is the Cerverax. Okay, so these three vaccines we have already discussed in the previous class, and in that one I had told HPV, the human papilloma virus vaccine, is completely contraindicated in the yes during the pregnancy. Okay, so it is also contraindicated in the pregnancy, and the safe vaccines in the pregnancy. Remember, bacho, influenza is the safe vaccine in the pregnancy, and with the help of the mnemonic, we have to remember. Okay, there is the Rohit Sharma, the Indian captain Rohit Sharma. Okay, so R stands here as a rabies vaccine. Okay, this rabies vaccine we have to administer as a post exposure prophylaxis in the dog bite case. Okay, in dog bite case, this is completely safe during the pregnancy. If the woman is pregnant and she got the dog bite, means can we able to give the rabies or not? Yes, we can give the rabies. It is completely safe in the pregnancy. Then comes to the hepatitis B vaccine. Okay, this is also completely safe in the pregnancy. Then comes to the influenza. Okay, influenza vaccine also completely safe in the pregnancy. Then comes to the TD. Okay, that is the tetanus and diphtheria is also completely safe during the pregnancy. Yes, is the safe. Okay, yes is the safe. So these are the safe vaccines during the pregnancy. We have to remember that the rabies, hepatitis B, influenza, and TD. So these are the safest vaccines during the pregnancy. Okay, so what all are the vaccines we can say contraindicated during the pregnancy? All live vaccines contraindicated during the pregnancy. Okay, all live vaccines are contraindicated during the pregnancy. R, that is the measles, mumps, rubella. Then comes to the then BCG. Okay, then OPV. So these all are contraindicated during the pregnancy. Okay, yes, bachcho, can we? Yes. Yes, that is the clear. Yes, clear. Okay. So then comes to the our HPV also contraindicated, chickenpox also contraindicated, and smallpox also contraindicated. Okay, smallpox, chickenpox, then smallpox. So these all vaccines are contraindicated during the pregnancy. Okay, these all vaccines are contraindicated during the pregnancy. So there is some situations where the examiner can ask. Okay, so vaccines which are contraindicated but given in high prevalence area travel. Okay, high prevalence area travel. What happens if a pregnant woman, she is traveling to the area where the disease is the highly prevalent? In such a circumstances, we have to give the these particular vaccines. Okay, so that's the cholera, yellow fever, and polio. Okay, so this is the cholera. Okay, this is the cholera, yellow fever, and polio. So we can say sometimes this one is the plague. Okay, both are actually contraindicated, but in some circumstances we have to administer these vaccines. Why? Why? Because this cholera, yellow fever, and polio or the plague is almost in eradication stage in our India. If a female she is traveling to the country where these particular diseases are still highly prevalent, so she can get the infections from there to our country and she can spread to the entire country. So that is the situation. So because in order to prevent that particular situations, we have to give the vaccines to that female who is traveling to the high prevalent area. So these vaccines we have to give to that particular female. That is the cholera, yellow fever, and polio. Okay, very very important, and very important you have to remember on this one. Okay, so yes, there is the plague also we have to administer if she is going to the high prevalent area. Okay, bachon, clear na? Yes. Okay. So this is the very very important. Okay. These all are the contraindicated, but we have to give because the country is the first. Then so these are the completely contraindicated vaccines during the pregnancy. There is the all the vaccines are contraindicated during the pregnancy. But this includes in the measles, mumps, rubella, BCG, OPV, chickenpox, and smallpox. Okay. So these vaccines are contraindicated, and this Rohit is completely safe in the pregnancy. Okay. There is the safest Sharma. Then yes, shape is the Sharma, that's the TD, influenza, hepatitis B, and rabies. Okay, so these are the vaccines which are safest during the pregnancy. Bachon, clear? So in the options, yes. This is the option from the Rohit. Okay. So this is the rabies, influenza, hepatitis B, and tetanus. Okay. This is I indicating the flu. That is the influenza here. Okay. This is the safest vaccine during the pregnancy. Hope the concept is clear for this question. Bacho, is that clear? Yes, it's very nice of you. Okay, so here's the next and very important question for you all. Okay, so do read the question properly, perfectly, then give the best answer in the comment box. Okay, yes. Which of the following is considered a warning sign during the pregnancy? During the pregnancy. Okay, yes. Which of the following is considered a warning sign during the pregnancy? So do comment your best answer in the comment box. Okay. So it is very important and most important. Okay. Option A, heartburn. Option B, vaginal bleeding. Option C, frequent urination. And option D, morning sickness. Bacho, so do comment your best answer in the comment box. I'm waiting for your comment in the comment box. Bacho. Yes. Very nice, very nice. Okay. Yes. There is the vaginal bleeding, which is indicating it is a high risk and it is indicating the high risk pregnancy and it is a warning signs during the pregnancy. But it will indicate the two conditions here. Okay. The vaginal bleeding during the pregnancy. Okay. So it indicating the two particular conditions after the 28 week of the gestation. Okay. After the 28 week of the gestation. That is the if vaginal bleeding occurs with pain that indicating the abruptio placenta. Okay, so this is the painless means that is the placenta previa. Okay, so here the blood which is coming out of the vagina is the dark red. Here it is the pink red. Okay, yes, in the history the examiner given the pain. Okay, the pain with vaginal bleeding with dark color red, so that is indicating abruptio placenta. In the questions the examiner given, okay, painless pink red, okay, vaginal bleeding that indicating the placenta previa. These both are the high risk pregnancy. Okay, these both are considering the high risk pregnancy. Okay, so this is indicating the warning sign during the pregnancy. But your heartburn, what is the heartburn? Heartburn is the burning sensation over the our fundus of the stomach. That is what we call the heartburn. So this is the normal during the pregnancy. Why this is normal? But very importantly, you have to understand the normal situations in the pregnancy. Already we have discussed. This is the our beautiful esophagus and this is the our stomach. So here we are having the lower esophageal sphincter. Okay, here we are having the lower esophageal sphincter. Also we call this one as in the cardiac sphincter. Okay, so in the pregnancy, because of the progesterone hormone, it is a smooth muscle relaxant. The progesterone is a smooth muscle relaxant. It will relax us the lower esophageal sphincter and there is reflux of the food from the stomach to the esophagus. So this will lead to the heartburn or the pyrosis. Okay, or we can say there is a GERD also. It is physiological during the pregnancy, but very important. So this is the condition, and in order to prevent this one we have to advise the female to take the small and frequent diet. Okay, small and frequent diet. So we have to advise the female to avoid the large or copious amount of the diet at single time. So we'll advise to take the small amount of the diet. That is the helpful for in order to prevent the GRD or the heartburn or the pyrosis during the pregnancy. Okay, bachon clear? Very important and very nice. Okay, so option C, it is telling the frequent urination. Already we have discussed on this particular situation. The frequent urination occurs during the pregnancy. Okay, in the first trimester and in the last trimester. Why? Because yes, why? Because so this is the symphysis pubis bone. Okay, and this one is the pelvic cavity. Okay, this one is the pelvic cavity. Yes. Okay, this one is the pelvic cavity. So this one is the uterus, and here is the bladder. Okay, here is the bladder. Okay, here is the bladder. Bachon, what happens here in the early pregnancy or in the first trimester, the uterus starts growing and which creates the pressure on the bladder. Okay, so the bladder will throw the urine repeatedly, means increased time of the urine. Okay, so increased episode of the urination, that is what called the increased frequency of the urination in the first trimester because of the pressure on the bladder by the uterus. Okay, again in the third trimester, the fetal head will comes and which creates the pressure on the bladder. Again the frequency will increases in the third trimester, and in the second trimester frequency is normal. Okay, second trimester frequency is normal. In the third trimester and first trimester frequency is increased, so increased urination frequency which is normal during the pregnancy. Then comes to the morning sickness. What is the morning sickness? Morning sickness is not any disease condition, so this is also physiological and which happens in the many of the females even after when after they will get pregnant. Okay, so what happens? So this is HCG hormone. Okay, so which will start rising. Okay, and at the 10th week, it is at the peak, and at the 16th week it will comes to the normal. Okay, so when the HCG hormone it will be in his peak. Okay, when the HCG hormone it will be at peak, so it will repeatedly creates the nausea and vomiting sensation. So this one what we call as in the morning sickness. What we call this one as the morning sickness. There is the nausea vomiting sensation because of the high HCG hormone around the end of the first trimester. This is what we call as the morning sickness. This is also normal during the pregnancy. It is not indicating any warning signs. Okay, so morning sickness also normal. Okay, frequent urination also normal, and heartburn also normal, and vaginal bleeding is only condition which is as acting as a sign of the, sorry, it is acting as here as a warning sign during the pregnancy. Okay, so here also we have discussed, yes, the vaginal bleeding with pain and dark red bleed, that is also that is what we call the abruption placenta. Painless vaginal bleeding, okay, pink red blood, that is what we call the placenta previa, already we have discussed. Okay, so very important. Here is the next question, and very important and most important question in front of you all. So do read the question properly, perfectly, then give the try to give the best answer for this particular question. Okay, so what is the primary treatment approaches for the gestational diabetes? Yes, so we have discussed, yes, the gestational diabetes already. So in that one, what is the primary treatment option we are having in the gestational diabetes? Bacho, yes, already have discussed what is gestational diabetes. Gestational diabetes means she is the normal woman. Okay, she is the normal woman without any diabetes. She got the pregnancy. Because of the pregnancy, we are having the like HPL. That is the, okay, HPL hormone. So that is the this human placental lactogen. So this HPL creates the resistance to the insulin. So the insulin resistance which leads to the increased blood glucose level in the pregnancy, that is called as the gestational diabetes. Or another situation we have discussed. So already a diabetic mother. Okay, now she will get pregnancy. Okay, now she will get pregnancy. This is what we call as the overt diabetes mellitus. Okay, so overt diabetes mellitus, always first treatment is start insulin. Okay, is the always first treatment in the overt diabetes mellitus. But in the gestational diabetes mellitus, always first treatment is the lifestyle modification. That is the dietary control. Okay, and exercises is the takes the priority here in the gestational diabetes mellitus. Okay, so in the question what they have asked, yes, in the question they have asked, what is the primary treatment approaches for the gestational diabetes? Gestational diabetes means lifestyle modification takes the primary or the important or the priority treatment. Okay, so insulin injection is the, yes, first treatment in the overt diabetes mellitus. Okay, if in case of overt diabetes mellitus, the insulin injection is the priority. Okay, so lifestyle modification, diet and exercises we will recommend to the pregnant woman with gestational diabetes. 90% pregnant women will get control over the diet modification. If it is not controlled by the diet modification, then investigation of treatment of choice we are having is the, again, insulin. Okay, again insulin. Why insulin? Insulin will not crosses the placenta, and insulin will not damages the any fetal organs. So very importantly, insulin is the drug of choice to treat the gestational diabetes mellitus. Insulin is the drug of choice to treat the overt diabetes mellitus. But in the gestational diabetes, we have to first control with the diet and exercises. So after failure of the lifestyle modifications, so then we have to go for the insulin. Okay, so if in case So the pregnant mother, she avoids the insulin. She don't want to take pricks. So then we have to go for the oral hypoglycemic agent as the third or the last priority. Okay. Among these, only two medicines, metformin and glyburide, are used. Okay. So among these, only two, metformin and glyburide, are used. Another medicines we can't use in the pregnancy. Okay. So this is the last treatment. Okay. Last treatment options. First treatment option is the lifestyle modification. Then second, if it is failed, then go for the insulin. If mother don't want to take pricks, then go for the metformin. Okay. So this is the very important concept you have to keep in your mind on the management of the gestational diabetes. So in the tomorrow's class, again we will discuss the very important on the gestational diabetes, pregnancy induced hypertension, what is the eclampsia, preeclampsia, what is the severe preeclampsia. Okay. So what is the like MGSO4 medication regimen, which is the Pritchard regimen, what is the Jupsin regimen. Okay. How examiner will get confused you people in the Norcet 7 exams. So everything we will discuss in the tomorrow's class. Okay. So stay connected with the master nursing classes. So this was the last question of the day. So again we will discuss the more important questions in the tomorrow sessions. Okay. So don't miss the session. So that will be very helpful and useful for you all. Okay. Again I will come with the important questions and concept in front of you all. If anyone is new to the our MNC family, yes, if anyone is new to our MNC family, so do subscribe to the channel, and we have the very beautiful Telegram group. So you can join there also to become a MNC family member. Okay. So we'll end up the today's class here. Again, we will meet in the tomorrow's class. तब तक के लिए जय हिंद, जय भारत.